Hi, my name is Jenny Lauren Dowden for Conduit News, and today we are joined by Shayne Joy. She is a registered nurse at Washington Regional Medical Center, and she's here to share her story with what it has looked like for her over the past year with the pandemic and now with the vaccine mandates. Thank you, Shayne, for being here.
Thank you.
So this past year with the pandemic, just give us a brief picture of what that has looked like for you as a nurse here in Northwest Arkansas.
So originally I came from Texas, where it all started, which was a whole nother world, essentially with a bigger town. Everything came here because it was smaller, all the things. And I got into a new position, and I'm a circulating nurse in the OR. So I thought it'd be a lot better with less patient care and all that kind of stuff. But it's just progressively just instilled more and more fear, more just everything doesn't make sense of what they're doing. The waves have gone up and down with COVID supposedly, yet me being in the OR, I don't see everything that's out on the floor, but with the waves, you would see a spike with the patients that I take care of, and that's not the case. So everything's just weird right now in healthcare.
It is. Well, so with the vaccine mandates that we've seen come through with these large corporations, and now at Washington Regional and area hospitals such as Mercy, when that happened, what was your initial reaction? Were you like, oh, that's not a big deal, or did you think something else?
I thought it was very weird. We were in a meeting one day. We have our Thursday meetings in our break room. And when it became mandated, our manager or head of the OR guy, he came in and said that we are starting to, or Mercy mandated the vaccine first. And then he came in and told us, because Mercy did this, we have to follow suit with Mercy, which I find very weird. And I'm not from here, so I don't know how it usually works here. And then in the same sentence, he said, because we are getting pushed from the government, that we need to start mandating this vaccine.
And then what was there talk amongst you all, or was it just like, no one said anything and they just, went along with what they were saying?
No one said anything. Well, very few, me included. As my coworkers know, I'm very vocal about what is going on right now, because it's not okay. It's not okay with anything in healthcare to be forced to do something. My main concern is the long-term effects with childbearing, and I'm in my 20s. I have the rest of my life to look forward to. We don't know how this vaccine does long-term. And the reason that I think this is because I got the HPV vaccine when it was not studied, and it was in its EUA. And I had some very big side effects from it. And so did some of my families. And at the time I was in my, I think, first year of college, and I did not know to educate myself on it. I trusted my healthcare providers and I didn't question anything, and it caused issues.
So what are you seeing right now regarding, what we are hearing from physicians and from other healthcare professionals about COVID and about the vaccine? What is your opinion on everything that we're hearing right now?
It's really weird because on one hand, it says COVID is this terrible, deadly disease. If you get it, you're going to die. And then on the other hand, which is more to what I've seen, is if you get it, you get it and you're fine. You have a very, very, very low likely chance of dying from it. And I've had COVID. Beginning of August, my boyfriend essentially brought it back home with me, and I was laughed at when I told people my symptoms. I had a very mild headache, like, the sinus, the very just enough to be annoying that meds don't work with. And I was just like, I'm gonna go get tested. I went through the drive line, and they laughed at me because they said, oh, all you have is a headache. I was like, yeah, if I spread this to my department and to my patients, I'm going to feel terrible about it. So swab me, let me know, and then I'll continue on my way. And I ended up having it. So it's just like actually having it, knowing people that have had it, have had flu-like symptoms essentially, and then other people, like my sister has also had it. She lost her sense of taste and smell, and my 4-year-old niece had it, and everyone is perfectly fine.
So regarding the vaccine and the mandates, it seems like there's not a consensus among physicians and healthcare providers. Why do you think that is?
Because I honestly have no idea. I don't know everything about this vaccine. I just know the studies that I've read that it is not foolproof, which no vaccine is, but what's the point in putting something in your body if it doesn't do what it's supposed to do? Which I think some people are relying on the fact that, oh, there's this new vaccine, it must work.
Mhm.
And then people are actually seeing what it does. And like people that get vaccinated, they are still carrying the virus to everyone. They are still like, they have little to no symptoms, which makes them a higher threat to society than for me, who is unvaccinated. If I, granted, my symptoms were very low, but at least I saw them and I noticed them. People who have the vaccination, they have very little symptoms, if any symptoms at all, and they are out and about not wearing a mask, because if you're vaccinated, you don't have to wear a mask.
Right. Let's talk about there at the hospital where you're working. So you applied for, when the mandates came down, you applied for a religious exemption.
Yes.
And how did they handle that?
I turned it in. Well, first off, I had to find it because it was nowhere on the internet that I could find. So I had to call employee health to have them send it to me because it wasn't readily available after the mandate happened. Then I found a pastor that would write me a religious exemption, and I got it notarized. I notarized another form paper, turned it in on August 2nd. I called HR 2 or 3 times. I had one of my managers call HR for me, and they continue to just tell me, you're just gonna have to wait. You're just gonna have to wait. Like, no.
Yeah. How long did they finally tell you that they will be making those accommodations for you, that they accepted it?
A month and a half.
And then since they've done that, what does it look like at the hospital? So your religious exemption was accepted, approved. You will have the opportunity to work past that October 1st deadline. How do those accommodations look differently now that you're in the hospital?
So for one, I have to wear an N95. On October 1st, it starts October 1st. So on October 1st, I have to switch from my normal surgical mask, which I wear every single day at work currently, to wearing an N95 mask at all times.
So if they want you to wear an N95 mask beginning October 1st, why wouldn't they have had you wear that prior to October 1st?
That's my question.
Okay.
There's no sensible answer except for punishment. And if they were genuinely concerned about people's health, it would have been required to wear an N95 throughout this entire pandemic. Otherwise, it makes no sense.
And then what else? Has anything else changed?
We now have to, if we are to remove our mask at any point in time so I work 12-hour shifts. If I need a drink of water, if I want a breath of fresh air, or just to have some relief from the pressure and the pain of that N95, I must be outside. I cannot be in the facility. I have to be outside somewhere. If I want to drink water, I have to be outside.
Does this feel like this has transitioned from being about public health and safety to something else?
Yeah, it's about punishment. It's about strong arming people to getting this vaccination, even though they don't want it, and even though they have an exemption from it. It is causing a lot of segregation in the workplace. It is causing violence. It is causing very hostile issues, and it's just segregating everyone. Like, I have to eat outside in the elements. Before I signed my exemption, I went to HR and I asked them, because obviously they didn't think about these things, because I'm a circulator nurse, I have to sleep in the hospital sometimes. I asked them, so what happens if it's raining or sleeting or snowing? And they said, you have to eat outside. There's some picnic tables, which I think one of them are covered. And if we're supposed to be following the distance guidelines, or all of them, shouldn't all of them be covered at least? And then if there's only one, then I'm screwed there.
Yeah.
And then I've been attacked at work by people, by coworkers, verbally. Nursing is also it's normalized to get abused in nursing by patients, by doctors. I get screamed at. It's very normalized to be abused. And this is pre-pandemic, where I've been beaten, I've been yelled at, I've been spit at, I've been scratched, I've been assaulted, and it's normalized. But now with the fear that everyone is pushing, it's a more hostile environment, because now I have a Star of David on my face. I have an indicator of that I am not vaccinated, and the people in the healthcare system that are inpatient, the patients that I am caring for on a daily, they are going to know, and they are going to be in fear for their life, for the care that I take care of them. Not because of the care I'm providing, but because of what I've chosen not to put in my body.
So our legislators are meeting. We talked about this. They're coming back to the Capitol tomorrow. We want them to consider legislation regarding COVID-19 to protect employees, to prevent employers from from enforcing these mandates. If you are sitting here with a legislator right now that he has the opportunity to put forth a bill or to vote on a bill that would protect health freedom, what would you say to him?
Would you force your daughter to do something that she wasn't comfortable with? Would you force your mother to take a medication that she wasn't comfortable with? Why are you trying to force things on people and taking away their choice? Patients have a right to refuse any kind of care, any kind of med. I've had demented old ladies not want anything. And I've had a 70-year-old refuse pain medication that just had a hip done when I was working on the floor. And then I've had a 20-year-old drug addict beg for medication because he's in pain. So if I needed to choose, if I wanted to make a choice for these people, I'd say, you're a drug addict, you do not get this medication. You've had legitimate surgery, you get this medication. I don't have that choice as a healthcare provider, because it is not my decision what goes in your body. If I'm able to give you a med that's going to relieve your suffering, I will do it. If it's safe for you, of course. And if it's prescribed. But if you don't want something, I'm not going to force my 70-year-old lady, like while she's asleep, I'm not going to push her a pain med. That is assault. That is battery. I can go to jail for that. So why is it okay for them to force things upon me? That is harassment. It is constant harassment at work, and it's getting out of hand. People don't realize that. Like, my coworkers are harassing me. Some are very understanding of what I'm going through and the things that I'm trying to fight and the reasons why I'm fighting it. Like right now, my job is safe, but I have coworkers that are in the same boat as me that have deep-seated religious issues, and they got fired for it. I just got notified today of 2 that got fired for it. And it makes no sense. Like, why are we forcing people to do these things? Why are we taking away their livelihood? Like, they did not have to go into healthcare. They chose to care for people for a living. That is a hard thing to do. And we're just saying, oh, well.
Yeah. Well, thank you for coming on here and telling your story. I know that it's not an easy one, but we appreciate you and are thankful for your bravery in all of this.